Unbelievably large amount of the cases you have swollen feet, ankles, or any part of your body because you have accumulated a lot of sodium in your body and you will not correct them with the potassium. In the later part of the video, I'm going to give you another minerals that work perfectly together with potassium, and it will help you with your swollen ankles, feet, or any part of your body. When sodium is too high and potassium is too low, the body often begins to hold more water. And this is one reason why many people feel more swollen feet after salty meals, processed food, restaurant food, bread, sugar, and the long sitting. And the problem is not only water, the problem is the balance between sodium and potassium. And so potassium actually in the short acts as a counterpart of the sodium in your body, so you must have potassium in the sodium in normal level and you will have no problem with swollen legs. Unfortunately, that is not the case. You have the swollen feet, ankles, and similar kind of conditions because you have heart problem, you have the liver problem, you have the kidney problems, and you use a lot of those chemical medications. The mineral partners are magnesium and calcium. Potassium is the key mineral for fluid control, but it does not work alone. Magnesium and calcium are also important partners. Magnesium supports muscular relaxation, nerve function, blood vessels tone, stress response, sleep, cramps, and tension. And calcium is important for the muscle function, nerve signaling, and the bone health. And the body does not work with one mineral only. Potassium, magnesium, calcium, and sodium must be in balance, and that is the real secret. This is how I helped thousands of my patients with those fluid problems. I correct them almost every time: magnesium, calcium, potassium, and sodium level. And this is just one part how this can help you a lot. What really happens when you get more potassium for 7 days after 50? And day 1, your body starts receiving a new signal. And on day 1, do not expect dramatic changes. Potassium is not a painkiller. It is not a miracle diuretic, and it is not instantly remove liters of fluid from your body. But when you begin increasing potassium-rich foods and reducing salty processed food, your body starts receiving a different signal. The sodium-potassium balance begins to shift, and your kidney may begin to regulate fluid differently, and your cells may begin to handle water more intelligently. And some people notice slightly more urination, and some feel a little less heavy. Some notice nothing at all. This is normal. Day 1 is not the result. Day 1 is just the beginning of something that is so crucial for removing your swelling in your body. And if you are constant, you take good quality supplementation, you take good quality food with your potassium, on the day 3, fluid balance may start changing. By day 3, some people begin noticing small changes. The legs may feel slightly less heavy. The ankles may look a little less tight in the evening, and the rings may feel a little less tight. The face may look less puffy in the morning. But this usually happens only when potassium is increased together with the right changes. You must reduce sodium, you must reduce sugar, you must drink enough water, and you must move your legs. You must stop eating the food that keep your body in the constant state of the fluid retention. So this is so important, especially for everyone who already are suffering from potassium deficiency. Do you have potassium deficiency? You must check your blood test, blood results, go to your doctor, seek if you have fluid retention information. Do you have deficiency in potassium? So if the potassium is in deficiency, you really can help yourself in the easy way. On the day 7, this is where many people notice the difference. By the day 7, many people who follow the protocol correctly begin to see clearer difference. The ankle may be less swollen at the end of the day, shoes may feel less tight, and the morning puffiness may reduce, and the leg heaviness may improve. Muscle cramps may reduce if low potassium was part of the problem. But I want to be honest, if swelling is caused by heart failure, kidney disease, liver disease, blood clots, advanced venous insufficiency, lymphedema, medication side effects of another serious condition, potassium alone will not solve the problem. In those cases, swelling is not just a mineral problem, it is a medicinal signal. And potassium can be extremely important, but potassium is not complete diagnosis, it is not complete treatment. This video, please try to remember, key part of your swelling is going to be potassium, magnesium, and calcium, and the sodium regulation. If you want to learn a lot more what is the best vitamin that really can help you with your swollen feet, watch my video right here. Thank you for following my viewers. See you in the next time. Bye bye.